Some really important points very well made there by Charlotte Underwood. Thank you, Charlotte. Plenty of ideas for me there to start to scribble down on my post-it notes. I'd encourage you to start to capture some of those, ladies and gentlemen. And just on a personal note, I mentioned in my This Is the Place poem, my mum lived and died here. She loved it, she did. And the truth of that story is my mum was given a fortnight to live and lasted 10 years with the amazing world-class care of our NHS. She had a very, very rare tumour on the top of her spine, the base of her brain. She had 2 or 3 world-class operations. She was in Tameside a great deal. She was in Hope as well as a few times, St Mary's, Christie's, hospices. And she received world-class care, which as a working-class woman, was something we're very, very grateful for. But, my dad was born disabled and left school at 14, and navigating 10 years of the health system was hugely challenging for him. Just things as simple as my mum's legal name was Christine Elaine Walsh, but she was known as Elaine. Just things as simple as getting the name right really do go a long way. So thank you very much for those important points, Charlotte. Next up, we have Andy Burnham, who of course is our new mayor here in Greater Manchester since May 2017. Andy, of course, was MP for Lee from 2001, and in government held ministerial portfolios at the Home Office and the Treasury, and of course the Department of Health, where he was a passionate advocate of integrating health and social care. Andy, in his first few days in the post, had the terrible Manchester Arena bombing to deal with, which I think he's acquitted himself very well with, and is also making great strides in tackling our terrible homelessness situation here in Greater Manchester. Ladies and gentlemen, can please give a very big welcome to Andy Burnham, please.
Thank you very much indeed, Tony. Good morning, everybody. It's great to be with friends, old and new, on this important day as we challenge ourselves and look to the future here in Greater Manchester. It is particularly great to be with you, Tony. I just want to echo what Peter said. For anyone who challenges the idea that culture can improve people's health, I saw Tony's words affect the collective well-being of Greater Manchester as I stood behind him on that day. He did, as Peter says, lift everybody just when we needed it, and it's absolutely brilliant, Tony, that you're here with us today. Your ruling about lunch and dinner just kind of reminded me of an anecdote from my university days. This is the point where Kevin looks at me and thinks, what the hell is he going to say now? And never in my position should you give anecdotes about your university days, but I'll just give you this one. It was when I went out one night with a friend called Sean from Middlesbrough, and we went to one of the posher colleges in Cambridge, and he got chatting all night to a woman called Portia. And at the end of the night, she said to him, let's go out for dinner tomorrow. So the next day, he turned up at her door with his hair all brushed, his dinner suit on, banged on her door, and she said, what the hell are you doing here? It was, of course, 12 o'clock midday, and needless to say, he never heard from her again. So, but we'll call it dinner, won't we, Tony? And he's dead right on that. It's great to follow Peter and Charlotte because both have celebrated how far we've come on this journey and the many great things that are happening here in Greater Manchester and always have. So much to celebrate. But today, I think, is about seizing the opportunity that's before us, the opportunity that devolution in Greater Manchester, that has been long argued for, seizing the opportunity that presents to write our own script, our own future, to do what Greater Manchester likes doing best, and that is to do things differently, to do things better. That's our opportunity. And it's not just falling to me, it's for everybody in the room to write this new future. And that's what I hope we can do together over the course of the next few hours. As Peter said, next year, next July, does mark the moment, 70 years on, when the then Minister of State for Health came to Greater Manchester to inaugurate the new National Health Service. 70 years on, I think it is right to question, where are we today? How far have we come? There are big positives to celebrate, but I also believe big risks ahead of us. The big positives are that the NHS model, the way of providing healthcare, where everyone contributes, but then everyone's covered for all of their healthcare needs, has proven itself as the most efficient and effective way of providing healthcare to the whole population, envied around the world. The other big positive is it's held in unprecedented public affection. The support for the NHS is rock solid, and the public want to see the NHS continue to flourish into the future. But there are big risks ahead. Peter mentioned the financial pressures, and they're significant. We all know that. But there's another risk that lies alongside that, and it's, in my view, a model of care that isn't yet right for the 21st century and all of the new challenges that is bringing, the new questions that this century is asking of our NHS, questions around whether it can give sufficient priority to people's mental health, given that modern times mean so many people in Greater Manchester are living with unprecedented levels of stress. We have an epidemic of insecurity in our society these days in terms of the way people work, with part-time or 0 hours work. Also, the fear of being evicted from one week to the next because of our dysfunctional housing market. The NHS has got to be able to respond to that. Also, the questions that the ageing society is asking of the NHS. How do we help people continue to make a positive contribution to society and break away from this awful way of describing older people as the problem, as bed blockers? That's got to go, that kind of language, because it talks about people as if they're the system is what is important and it's the people that are the problem. We can't carry on talking in that way. But also, the NHS has got to have answers to the lifestyle challenges that come around obesity or addiction. We need to help people improve their health. So we have to have a model of care that's ready for the 21st century. And I don't think we are there yet. We've got some way to go. But if anywhere's going to get it right, then we're going to. The place that gave birth to the NHS 70 years ago is now in a unique position to give it a rebirth for the 21st century. And that is what I want to lead with you as your mayor. And I've been asked today to set out what is my vision for that. So let me give you just a few kind of thoughts on that, and you'll get where I'm coming from, I am sure. So here's a starter for 10. I would like to see in Greater Manchester, in time, because it can't happen overnight, but I would like to see a national health service that supports people with dementia as well as it treats cancer. I think that is something that we should be aspiring to provide in the 21st century. However, at the other end of the life journey, I would like to see an NHS that intervenes at the earliest moment in a child's journey and particularly identifies those with the greatest needs, the biggest challenges, children with autism or with disabilities or complex needs, who need that early help so that they can fulfill their potential. As we heard from Charlotte, sometimes it's not always there. Some of it might be there, not all of it. And the parents of those young people often face a battle, a daily battle to get the help that they need. Well, I'd like to see an NHS that sees the whole child and provides that support when they need it, that ensures that all kids arriving in reception class are ready to learn in Greater Manchester and then fulfil their potential. I would like to see a National Health Service that actively, every day, promotes complete physical, mental and social well-being, rather than just working to remove disease or infirmity. That's the World Health Organization definition of health, and we should be the first place in the world, the United Kingdom, that says we're going to do it. We are going to deliver that vision of health. One service for the whole person, physical, mental, social, looking after all of their needs, but not just breaking down the silos within the NHS, making those strong bonds with the rest of the public sector, with housing, with education, with transport, with leisure, with policing, so that we have that whole person model of support. I would like to see an NHS where people's loyalty is not to the individual organisation they work for, or even the part of the system in which they work, but is to that drive to improve population health, where we think of ourselves as one NHS with that mission always in mind about improving population health. And I think what all of this points to is an NHS that has at its heart a new model of care. Preventative, person-centred, where we have place-based, multidisciplinary teams, providing support around the person, helping them to live their life rather than treat them as a patient, intervening at the moments when they need support rather than letting them fall beneath the cracks. That, I hope, is a vision maybe that we can all come around and you would be able to add to, but if you get what I'm saying, it's about moving from a medical treatment model of support to a person-centred social model where somebody is as likely to leave their GP practice with help to improve their exercise, their diet, to get counselling, therapy, debt advice, housing advice, as likely to leave with that kind of support as they are with a prescription for medication. You can see where this is going. And I think that's the journey we should set ourselves, to see if we can build a health service that is, as Nye Bevan wanted it to be, truly preventative, promoting the public health rather than just treating ill health. For me, this won't be achieved by people like me or Peter or John or any other of the other outstanding leaders we have in this room producing ever more strategy documents and ever more instructions to the system and expecting everybody just to implement them. We will achieve this if we work together, where every part of the system is an equal partner. The voluntary and community sector, no longer distrusted and given annual contracts, project funding, but longer term core funding, so that we truly unlock, we trust our communities and unlock the contribution that they can make towards this paradigm shift that we want to make from this medical model to a social model. But also we need to engage the staff working across the public sector in Greater Manchester and actually take away the strictures and the structures that put them in silos and stop them from working in a way that is probably more true to their vocation, i.e. promoting good health. And I think there's a real job for us all as leaders to win over the hearts and minds, and also to create the opportunity for people at the front line to work in this different way, to work as one team, one NHS, providing whole person care with their colleagues from other public services. And I fully intend to spend time as Mayor shadowing people right across the system, watching what they are doing, communicating my vision to them, and I would ask everybody in this room in a leadership position to do the same. Gone are the days of the top-down instructions from the top. This has got to be about all of us together, one Greater Manchester, improving the health of our public. But alongside this, of course, we have to be ready to train a new generation to work, to deliver this new model of care. And I think that has implications for how we think about bringing on young people to work in the NHS. For too many young people in Greater Manchester, it has become something that they can't aspire to anymore because of the scrapping of the bursary and the changes to university tuition fees. I think if we're going to rise to the challenge of the future, workforce is one of the biggest, if not the biggest challenge we face. We need a workforce ready to work in this new way, across those disciplines, across those settings, dealing with physical, mental and social care. And I would want us to look at how we can pioneer new ways of working with our universities to devise new routes into the National Health Service. And I do say this, if we are going to have extra challenges with Brexit in terms of our workforce, and as we already know, shortages in the nursing workforce has left us in the grip of private staffing agencies, how are we going to grow our own so that they can come through and provide the workforce of the future? I think we all need to do more, as Charlotte was saying, to support the younger generation. And the NHS should set the standard as a model employer, showing how work can improve people's health and well-being. So I would like to see a new deal for young people here who want to work in our NHS. And I do think if they commit to the Greater Manchester NHS after qualifying, then we should commit to them and help them with the cost that they face with respect to their tuition fees or their housing or whatever it might be. That, I think, will be Greater Manchester taking a lead and showing the rest of the country how you build an NHS workforce of the future. But of course, it is about saying to them, make your loyalty to the NHS as a whole, not just as to one organisation. And I think that is our great strength. I'll never forget the day driving into central Manchester at 5 o'clock in the morning, Tuesday the 23rd of May. I bet we all can remember how we felt on that day. I felt sick to the pit of my stomach, but things began to change as the day wore on. I didn't know what I was going to find, but what I began to find was a place that was already pulling together. People coming up to me asking how they could help, reports of the public going into our hospitals to support the staff who were just working wonders to provide the care that people needed at that time. What it told me is that this is a special place that has built strong partnerships over the years, and these are the foundations now on which we are building the strongest possible partnerships, both within the NHS, between the NHS and other public bodies, but actually a real strength of partnership with our communities too. And you know it, you can feel it yourself. If we capture that spirit going forward, if we build on that, then really there's nothing that we can't achieve. Finally, I would say to you, as somebody who has served as Secretary of State, and did, as Tony said, try and lead some of these debates from that level and tried to reform social care at that level, I came to the conclusion, and it was after 16 years in Parliament, that passing an Act of Parliament in the old way or publishing a white paper in the old way isn't going to change the world anymore. Life is fast moving now. It's much more complicated. I don't think you can legislate for the slowest and the fastest at the same time and make it all make sense. You won't be able to do it. And governments all around the world at national level looking increasingly dysfunctional as they are grappling with the fast-moving modern world, the changes in technology, the changes in the population and demography. And I've come to the conclusion that real change in the future will come the other way. It will come bottom up, and it will be the most progressive, radical, forward-thinking regions that drive that change. And as we all know, this is the place, to quote some words, of radical forward-thinking, social innovation and disruption. It always has been, and it's going to be in the future, using devolution and this opportunity we have to get the voice and the values of the people of Greater Manchester heard more loudly and clearly than they've ever been heard before. We are going to pioneer, I hope, a 21st century National Health Service in Greater Manchester that is, as I say, person-centred, not patient-centred, always working to improve the public health. I truly believe, however we've all got to this room today and the different journeys we've had in our professional lives, I truly believe that we will never get a better moment than this one right now. Because this moment is a moment when we can apply everything we've learned to really change things for the better. And we can do it for ourselves without somebody telling us what to do. And we would be doing such a disservice to the public out there if we didn't grab this moment, set aside some of our old loyalties and traditional ways of doing things, and actually think for the first time radically, outside of those silos, how can we change things for the better? It's a moment to grab, isn't it? It's a moment to make the most of. We can do it all. You know, we can achieve what we want to do. We've seen that spirit, what did Tony call it? The silver spirit of Greater Manchester, make us the capital of music, the capital of football. Well, now we have to be the capital of a 21st century NHS, where the rest of the country looks here to see how it's done. And looking round this room, knowing you all as I do, I have absolute confidence that that is exactly what we are about to do. Thank you very much, everybody.